On the Business Courier front page centerpiece this week, the last of a breed, why some Cincinnati doctors go it alone. Of Cincinnati's 1,100 plus primary care docs, there are only about a dozen who have a solo practice now. A new survey shows the solo model is fading fast. About 15% of all physicians across the country were practicing solo in 2013, compared with 21% in 2012, according to staffing firm Jackson Healthcare. And 55% of doctors said they worked either for a hospital or for a practice in which they had no ownership. Dr. Larry Wong, who has a solo practice in Terrace Park, is the exception.
I took over my dad's practice. My father was a family practitioner in Milford for 30 years. I grew up with it. We have patients that have seen us for 40 years now between the two of us. That's 5 to 6 generations of patients. So I inherited the business essentially. So long term, it's probably not viable. Short term, though, I think we can give it a go.
Not viable long term because Wong says the business model is challenging. Joining a network is a way to offload the administrative burden, ensure regular patient flow, and get access to costly technology, especially an electronic health record system. Dr. Dorothy Schaefer is an Avondale-based internist who's afraid a hospital system would push her to see too many patients. She gives attention to holistic medicine and has 300 persons on her waiting list. For profiles on some other local solo docs, be sure to read the full story in the print edition of this week's Business Courier.